Suseenth. I'm an intervention cardiology working in NG Hospital and Muthus Hospital in Coimbatore. Today I'm going to talk about an interesting newer drug that is inclisiran. Indians have a higher cardiovascular risk and experience earlier when compared to cardiovascular events. Elevated LDL cholesterol level are crucial due to strong and linear association of ASCVD. Each 39 milligram of deciliter reduction in the LDL cholesterol level has associated with the 21% reduction in the major cardiovascular. So strike early and strike strong. That is in multiple guidelines shows 2023 ESC guidelines, CSA guidelines, as well as 2022 American Association, Cardiac Association, as well as lipid lowering Indian consequence update shows better to reduce the LDL cholesterol level less than 55 milligram per deciliter in the high risk patient, and in very high risk patient, that is a multiple cardiovascular event or patient having a stroke, peripheral vascular disease, cardiovascular disease, or multiple risk. Extreme high risk patient, better to cut down on LDL cholesterol of less than 30. And extreme high risk patient that they given us 10 to 15 milligram per deciliter, that is only given in a lipid association guidelines. And you can see there is no significant association between the very low LDL cholesterol as well as safety outcomes. But in my practice, I have seen patient with 18 or 20 milligram per deciliter of LDL cholesterol level without any much of symptoms. And you can see the diagram shows that the safety events by achieving low LDL cholesterol level within a period of 2 years. That's not much elevation of they already few studies have shown that there is an increased risk of hemorrhagic stroke are associated with very LDL cholesterol level. But data-wise, very few patients have noticed. But there is not much of clear-cut evidence when you reduce the LDL cholesterol less than 15 or 10 milligram per deciliter. So inclisiran specifically works in the liver. Mimics the body process of RNA interference, which is restricted to the cytoplasm. So it is working in the hepatocyte level and low likelihood of target binding proteins. Inclisiran plasma level declines within 24 hours and not able to detect within 48 hours in the blood level. So inclisiran is indicated in adult with the primary hypercholesteremia. That's a familial hypercholesteremia or mixed dyslipidemia. We can use inclisiran in combination with the statins or statin with other lipid therapy such as estamide, bempedoic acid, and not achieve the target, that is the LDL cholesterol of less than 70 in the mild risk, 55 in the moderate or high risk, and very high risk less than 10. Or you can use any other combination with other drugs. And statin intolerance, we can use inclisiran. Inclisiran is useful in high risk cardiovascular disease patient whose LDL cholesterol remains inadequately controlled even with the use of multiple drugs such as statins, estamide, and bempedoic acid. And it is also useful in the treatment of heterogeneous familial hypercholesteremia. So the recommended dose is 284 milligram per deciliter. We should use that. Initially we start with a start dose, and we can repeat the dose after 3 months, and every 6 months we can use the inclisiran. There's a subcutaneous injection. Usually in the abdomen level we can use using like a subcutaneous heparin or subcutaneous insulin like injection only. Usually it will be like 1.5 ml, 1.5 ml cc. So dose and administration. If a planned dose is missed less than 3 months, then inclisiran should be administered and dose continued according to the patient original schedule. There's no big problem. If the patient is missed the dose and it's more than 3 months, then we can reschedule the administration. Once again, we can give a start dose, and after 3 months, you should give a dose, and every 6 months you can continue. Treatment transition from monoclonal antibody, there's a PCSK9 inhibitor. There's inclisiran can be administered immediately the last dose of monoclonal antibody, there's a PCSK9. To maintain the LDL cholesterol level, it is recommended that inclisiran is administered within the 2 weeks, the last dose of monoclonal antibody. So better to, after 2 weeks of monoclonal antibody, we can initiate the inclisiran. That's a better line of treatment. Which patient suitable for Inglycerin? Next slide. So that's a CSI guideline 2023. So lipid, if you are giving a high dose of statin, that is 40 milligram of rosuvastatin or plus estimate, or 80 milligram of atorvastatin with estimate. If LDL is less than 55, you can continue the routine drug. No need to initiate Inglycerin. You can repeat the lipid profile. If it is more than 55, then we can add bempedoic acid, and we can repeat the lipid profile, and we can monitor the LDL cholesterol. If you achieve the target LDL of less than 55, then we can continue statins, estimate along with bempedoic acid. If you're not able to achieve the target level, then we can add PCSK9 or inclisiran. So Cardiovascular Society of India recommend that the patient with the ACS, if the LDL target is less than 55, it's not achieved with a high dose of statins, bempedoic acid, PCSK9 inhibitor, then inclisiran can be administered. Next slide. So multiple guidelines shows a nice guideline recommended inclisiran with the ASCVD as well as heart failure with ejection fraction. That's the only thing. Multiple trial shows if it is a high risk patient, if not achieved the LDL target, that is more than 3.5 millimole of deciliter, and secondary prevention, you can use the inclisiran with the LDL of more than 2.6 millimole, then we can use the inclisiran. Next slide. Because same slides, so they're repeating the same slides. So Orion 9, 10 and 11 trial that shows ASCVD or ASCVD with risk factor equivalent, they're done in multiple countries. Inclisiran sodium 300 mg is administered, and 18 months study has been done, and almost status is completed. Phase 3 trial completed. Next slide. The shows that combining all three trials shows there is a significant reduction in the LDL cholesterol level, that is around 50.5 or 50.7 when you are using inclisiran. That's a drastic improvement when you use inclisiran when the patient is not achieved the target. With inclisiran, there is a strong recommendation. There's a maximum tolerated dose we can use the statins, and the patient is not achieved the LDL cholesterol less than 70. Then after that, when you use the inclisiran, 52% achieved, and the LDL cholesterol is less than 50 milligram per deciliter. Next slide. So that shows there is a reduction in the lipoprotein A, lipoprotein B, apoprotein B, and you can see that LDL cholesterol from baseline with inclisiran is around 52.2%, and the ratio of lipoprotein A baseline is approximately 41% lower when compared to the placebo drug. The p-value is significant. There's a 0.001. This is the only drug available that having a significant reduction in lipoprotein A. There is no other statins or any other drug is recommended or is not available reduction in the lipoprotein A level. Changes in lipid parameter after 510 days, that's almost 1 year and 4 months duration. You can see there is a significant reduction in total cholesterol, ApoB, non-HDL cholesterol, triglycerides, lipoprotein A, as well as HDL-C. So, and you can see that total cholesterol, ApoB and non-HDL cholesterol, the p-value is very significant. And this is the only drug available to reduction in the lipoprotein A, because nowadays lipoprotein A also is one of the familial risk factors in the patient who are having a young cardiac vascular event, as well as young patient who are having a young MI or young CVA. Lipoprotein and ApoB is slightly elevated. We're seeing multiple patients. So these are the patient, high risk individual, young patient, giving a multiple drugs and not able to achieve the targets, then we can use the inclisiran. And you can see there is a inclisiran is very well tolerated drug. We can see that's minimal pharyngitis is there, minimal arthralgia is there. Other than this, there is not much of significant side effects you can see. More participant expert inclisiran group 2, predominantly mild to having some mild transient discomfort. There is no much severe or any persistent side effect you can notice with the patient taking a inclisiran. As a well-tolerated, proven safe, almost like 7 years duration. And Orion trial shows open label extension, the Orion 3, 9, 10, 11, multiple, almost like 3,300 patients are included in the trial that shows cardiovascular risk is a very high cardiovascular patient, and the elevated LDL cholesterol patient shows there is a reduced LDL cholesterol level in the long term, which being well tolerated. And inclisiran act in the cytoplasm of hepatocytes and not into the cells nucleus. There is no risk of any cardiogenicity and immunogenicity level. And results are shown that long-term efficacy in the Orion 8 trial shows could reduce the LDL cholesterol level in the long term while being well tolerated. Orion 4 and Victorian 2P trial shows there is a significant reduction in the cardiovascular MACE outcome, that is around 26% reduction. And the Mendelian randomization study shows 20 million person year follow proven there's a dose dependent long log linear associated with the absolute magnitude of exposure in the vasculature of LDL cholesterol and the risk of ASCVD. So inclisiran shows there is a significant reduction in LDL cholesterol, ApoB, lipoprotein A, and major cardiovascular outcome. And intolerance to the statins, this is the wonderful drug is available currently in the market.